Can I start otherwise?
Yeah, okay.
Hello, I'm Jeannie, one of the doctors at the clinic today. May I confirm your name and age, please?
Hi, I'm Mariella and I'm 49.
How may I address you?
You could call me Mariella.
Okay, Mariella. And what is it that you do, Mariella?
I'm working at a banker.
All right. Mariella, can you tell me what brings you here today?
Well, to tell you, actually, for the past 2 years or so, I've been experiencing hot flushes and, I'm irritable all the time and snappy, and I don't really like myself, the way I behave with people around. And it's really difficult for me.
Oh,
I really
I'm
need
so
some help.
am so sorry to know this. I think it's affecting your quality of life. Yeah, don't worry. We
Yes,
are
it
there
is.
to.
Yes.
Yeah, I'm here to help you out and address your concerns. But before that, is it okay if I ask you a few questions?
Sure.
Yeah, Mariella, can you explain in detail about your complaints? You said you are having hot flushes. At what time in the day is it really bothering you?
Um, it's not, I cannot give you a particular time as such, but yeah, it's there all the time. And then sometimes
Mm-hmm.
suddenly I feel like a heat wave through my body, and I get all
Mm-hmm.
irritable. I'm not able to concentrate on my work. That affects my work as well.
Okay, all
So,
right.
yeah,
Mm-hmm. And any symptoms of palpitations, tiredness?
yeah, I do feel tired. No palpitations as such.
All right. Any pain or aches over your bones and joints?
No.
Hmm. And you said you're feeling a bit, mood swings. You have you're suffering from mood swings. Is that right?
Yeah, that's right.
Hmm. So this is really affecting your normal work, right?
Exactly. Yes.
Mm-hmm. Have you seen a counselor as yet, Mariella?
Yes, I am seeing a counselor, but
Mm-hmm.
it hasn't helped me much.
All right, all right, all right. Definitely, I'll address your concerns. And any other complaints like any urine problems,
No.
any dryness down below?
Yeah, I do feel dry.
All right. And please don't mind me asking a few intrusive personal questions. Are you sexually active?
Yes, I am. And I do feel
And
dry during sex as well.
all right. Okay. And is this affecting your relationship with your partner?
Well, my husband really loves me and he's very supportive, but at times I do get into fights with him. So, yes,
Hmm.
possibly.
All right. And any pain or any bleeding after sexual intercourse?
No.
All right. Can you tell me about your pregnancies earlier?
Yeah, I have two normal deliveries and they are both grown up. I have two
Hmm.
young girls.
All right. And they were normal deliveries?
Yes.
All right. Please tell me about your menstrual cycle. Have you attained your menopause as yet?
Well, I've undergone a hysterectomy 3 years ago.
All right. All right. Please, can you tell me more about your hysterectomy? Why was it done?
Well, yes, I was diagnosed with endometrial cancer, they said. It was early
Oh,
stage
oh.
and it was a hysterectomy. My ovaries were removed. And I think it's possibly
All
because
right.
of that that I'm having these
Mm-hmm.
symptoms.
All right. Any treatment like any other chemotherapy or any hormone therapy
No,
after that?
no.
All right. All right. Okay. And when did you last see your specialist?
I'm regular with my follow-ups. I last saw my specialist 6 months ago.
Okay. And your reports have been normal since then?
Yes, everything has been normal. They said
Okay.
that the cancer hasn't come back.
All right, that's good to know. And can you tell me any allergies you have?
No, no allergies.
And all right. And what about your smears earlier? Were they up to date?
Yeah, they were all normal. I've been regular with my
Yes,
smears.
yes.
They were all
All right. And what about, please don't mind me asking, do you smoke?
Yes, I smoke around 8 to 10 cigarettes per day.
I see. Okay. All right. Have you considered quitting smoking, Mariana?
Well, I'm addicted, and because of my work schedule, it's become a habit now.
You see, smoking is injurious for your health, not only for your general health, but also for your, it's a contributory factor for cancer as well. Okay.
Mm.
And also maybe contributing to your menopausal symptoms as well. Hmm? So definitely I would help you out in this. And also, what about alcohol?
No, occasionally I do have alcohol.
Any recreational drugs?
No,
Your weight for height ratio?
that's 35.
All right. So thank you for all that information. Would you like to add anything else?
Um, no, that's all.
Okay. All right. Any specific concern you wish to address?
Well, I was going through some material on Google and I found something like hormone therapy that can be given for these problems. So I just wanted to know if that's going to be safe for me.
Yes, I'm coming to that. Hormone therapy would, yes, definitely, this is one of the options. But before that, we would need to, address some lifestyle factors, all right? And like smoking, as I've said. So I would be referring you to the NHS Stop Smoking Services, which will help you out in that. Okay, and also you would be seeing a counselor and a psychologist as well, who are going to address your mood disorders as well. Okay, and also regarding therapy, and you would be also be given some calcium, vitamin D supplements as well for your bone protection. Okay. So,
Okay.
and yes, and also regarding hormone replacement therapy, you see, we have two kinds of hormone therapy, like estrogen and
Mm.
progesterone. So, estrogen, we can, since you have already had a hysterectomy, we can give you estrogen replacement therapy. Okay, because
Okay.
yes, and progesterone would be, we might need to give you progesterone for, because this might have a side effect on your breasts as well. Okay, so we might will give you the lowest possible dose, uh, and for the shortest period of time till you attain till the period of normal menopause at around 54, 55 years. Is that, am I clear on this?
Yeah, you are.
Yes,
Okay.
and
So
so
is it
this,
safe for me?
uh, uh, yes, this would be safe. However, there might be a few concerns, as I've said, regarding your breasts, because they may sometimes cause a risk because of breast cancer as well sometimes. So, and
Oh.
yes, and also, but this is helpful for your heart and for the bones and
Doctor,
joints as
actually,
well.
I've had another surgery, and wherein a lump was removed from my breast. That was 14 years ago, and they said
Oh,
it was not cancer.
oh. All right. So I would need to check your reports regarding what was actually the lump about, what is the pathology of the lump.
Right.
So yes. So then you would be now. Then I would be referring you to the multidisciplinary
Also,
team.
I'm
That,
worried about the risk of strokes because my father had a history of stroke, and I read somewhere that this hormone therapy can result in strokes.
Yes, yes. I'm sorry to know that about your father. So there is a small risk of increase in stroke as well. So so that is why I would be referring you to the multidisciplinary team. That would involve my consultant, okay, and the hormone doctor as well, and
Yeah, your
counselors
time is up.
and yeah,
Okay.
okay. Mm.
Yeah. So, Dr. Jeannie, any reflection?
Yeah, could not complete a bit haphazard. I need to organize the management thing.
Mm-hmm. Mm-hmm. Okay.
Maybe information gathering was too long for me.
Yes, that's right. Yes. All right. So here is a situation that is given to you that she is 49 and it's mentioned that she has menopausal complaints. Okay.
Hmm.
And it
Hmm.
is also mentioned to you that she's seeking hormone replacement therapy. Okay.
Hmm.
So you started well by saying, by asking an open question in the beginning. So what brings you here? And that's when I told you about my problems. You
Hmm.
asked in detail about the problems. I told you that it's been there for a long time, and you also managed to elicit sexual dysfunction that she had, the sexual problems that she had. Um, it's given that she has menopausal complaints. So the one of the first early questions should have been, when did you attain your menopause? Which I was waiting for because you asked a lot of other questions.
Yeah.
And
Hmm.
that was one important question that should have been asked right in the beginning. And then I
Hmm.
would have told you about the hysterectomy as well. Yes, you asked me about the details of hysterectomy. Good. The thing is, I noticed that you were repeating things. Like I said, I think I said something about the mood swings, and then you said,
Yes. Yes.
I believe you have mood swings. Is that right? I mean, it
Yeah.
would not fetch you any points because it's something that I've already told you, right?
Hmm.
So this can be avoided. Okay.
Okay.
So similarly, I noticed that a lot of questions were repeated. Okay, avoid that. Okay. A little more of practice, and I think that should be fine, right? Then,
Okay.
okay, so let's just go to the questions that you would be asking her, the relevant questions. Open question at the beginning, then the menopausal symptoms, yes. So ask her, she has hot flashes, night sweats, and mood changes. You asked about urinary problems, aches, pains, musculoskeletal problems, sexual dysfunction. You need to ask whether she has a sexual drive or she has dryness, and whether she has dryness, because the treatment may be different. Okay, and how long this has been there. Okay, then
Hmm.
another important aspect is mental health. Okay, history of depression, important. Quality of life, how does it affect her work life, home life, and her relationship with her husband? Then, whether she has any medical comorbidities, which was not asked. Okay, so that is another important question because when you're considering HRT, you need to know if there are any contraindications. So she had history of hypertension here in this station. Okay, so which he would have told you if we had asked her about
Hmm.
medical comorbidities. Surgeries, I told you about the hysterectomy, but you did not ask me if I have had any other surgeries, because then in the end she told you that there's history of lumpectomy, okay, which was a benign
Hmm.
disease, but you need to ask for history. Okay, so do not forget your history template. Of course, you need to ask the relevant questions only. We don't expect you to ask irrelevant things, but remember the template. At the back of your mind, you should have the template. So medical diseases, allergies, surgeries. Allergies, yes, you asked. Allergy in this particular station, lactose intolerance is important because if you are considering hormonal replacement therapy, oral replacement, then all of them have lactose uh, as one of the components, so you should not be giving oral. Okay. Then,
Hmm.
family history is one of the most important points in history. So, family history, she has endometrial cancer, she said, at a young age, isn't it? She said at the age of
Hmm.
46, it would be. She's 49 now. She had it 3 years ago, she said. So, whether she has any familial tendency for cancer. So don't just concentrate on one aspect of her problem. That's the menopausal symptoms. You have to look at the whole picture. So always a holistic approach towards patient management, right? So ask about family history of cancer. If she does have family history of cancer, whether she's screened for any genes and any other significant family history, like she told you, there's history of stroke in the father, important. Addictions, you asked. So I was smoking. Then support, she told you that her husband is supportive, which was so far was fine. Smears, BMI, examination here is important because, of course, if she doesn't know her BMI, you want to know her BMI, her blood pressure, because she said I mean, she didn't say, you did not ask for the history, but she is hypertensive, so her blood pressure becomes important. And breast examination because she's already had history of lump in the breast. Okay, so that's important. Then communication, empathy, sensitivity, avoiding medical jargon. You were empathetic, but it could have been, you could have said, okay, I'm really sorry to hear that. We are here to help you. All those things should be emphasized. And don't overdo it because then you would be wasting your time. But it's important to say that because that counts under communication with the patient. Information in chunks, which was okay. And non-paternalistic approach is basically when you don't impose your thoughts and your ideas on the patient. Okay, but the management was, you did not really reach the management. So, okay, as far as the management is concerned, you've said a few points, which was good. Like you said about the team of doctors. Okay, she would require a team of doctors to be looking after her because she has history of cancer, she has hypertension, she has obesity, she has smoking history, and she would need a menopause specialist. Okay, most important is lifestyle modification, which you need to advise everybody. And so what you would tell them is basically she needs to reduce her weight. Remember, her BMI was 35, so that has to be emphasized. The weight reduction, so diet, exercise, and other measures. Then stop smoking, important. Okay, and other things like avoid alcohol if that's possible. She said she takes alcohol occasionally. Avoid sudden temperature change like hot drinks, etc. Avoid spicy food. Increase exercise. Wear layers of clothes to be able to take off and put on when necessary. Practice relaxation techniques, cooling devices, facial spray, cold pillows, etc. So you can mention some of these. Then what you need to emphasize is that any medicines that would be given to her, it is unlikely they would be effective unless there is a lifestyle modification goes hand in hand. Okay, so it's important to emphasize on lifestyle modification, and this is how you tell them that unless you reduce your weight, no matter what medications I give you, it's not going to help you. Okay, so say it in a simple language. Say that any medicines that would be prescribed may not be effective if lifestyle modification does not go hand in hand. Okay. Cognitive behavioral therapy, basically talk therapy, and there could be counselors who could help you through this. Okay. Then you tell them about HRT. Now, HRT, is it safe in this patient? Because
No.
you did not mention about HRT not being safe for her. She has history of CA endometrium. She has history of smoking. She's obese. And then, okay, of course, these things you did not uh, gather on his information gathering. Well, there's family history of stroke and there is hypertension. Of course, individually, family history of stroke or controlled hypertension may not be a definite or a absolute contraindication to starting HRT, but you need to know more about it. And if there are many medical comorbidities, then it is not easy to start HRT, isn't it? When there's BMI,
Yes.
which is high, smoking, there is family history of stroke, she said you do not know exactly what it is. Then hypertension, you need to ask her whether it's controlled and whether she's taking any particular, what medicines she's on. Important, right? So, and there is history of CA endometrium. Is HRT entirely safe with history of CO and CA endometrium? Hello, Dr. Jeannie?
Yes. 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 You are
Uh,
audible.
yeah, is it safe? I'm asking you if HRT is safe.
No, it's not safe for this patient.
Right. So of course, it's not black and white. It's a gray area basically. So you
Yeah.
cannot really say it is not safe. You need to tell her that it may not be safe. Okay, I'll tell you exactly what is to be said in these situations. Okay, you can have multiple comorbidities that are given to you in the station. They may modify the
Dr.
station.
Ankita, I have one question. Should
Yeah,
we ask regarding the endometrial stage? Because in the early stages, we can give the HRT.
yeah. I'm coming to that. I'm coming to that. Actually, in fact,
Okay,
I said
okay,
that I was diagnosed to have early stage cancer. I said it in
okay,
my
okay,
when
okay.
I yeah. So you need to say that it may not, given all these factors. Okay, now I'm not taking individual factor. Given all these factors, they would have a synergistic effect on the risk, right? So it may not be safe. So
Ma'am, but if she's obese, we can give her patches.
yeah, yeah, yes. Wait, I'll just finish.
I think if she has multiple risk factors, so we have to avoid the hormone
Right,
therapy.
right,
Medical
right, right. Right.
safer.
That's exactly what I'm saying. So you say that it may not be safe, but if the symptoms are distressing, resulting in poor quality of life, you should consult a menopause specialist. You should refer her to an HRT clinic, right? Now she has discomfort during sexual intercourse, so you can offer her vaginal lubricants. So again, whether to give estrogen lubricants or non-estrogenic gels, which are also available, you can give non-estrogenic gels, but estrogen gels containing gels would be superior because they would maintain the pH and it would also prevent the problem of cystitis. Okay, but whether it is safe with all these factors, it's a query. Although vaginal gels are not systemically absorbed, so they may be safe. Okay, but what you need to say, you cannot say all this in the stations. You say that we could offer you certain lubricating gels. Okay, we may also consider estrogen gels if the lubricant gels do not help, but estrogen are only after consulting the menopause specialist because of the risks that you have. Okay, after having told her that these are the risk factors that we have identified. If she is now, and I've just mentioned this point on HRT with its common side effects, you need not say it if you're not giving her HRT at all. Okay, so it may be so that the patient may ask you about a specific thing. What about herbal medicines? What about phytoestrogens? I've read about vitamins and minerals, etc. Then what do you say? When they ask you about herbal preparations, you say there are multiple preparations available. Safety is uncertain. Different preparations may vary and they may interact with other medicines that you may be on. She's not on any medicines, need not say that point, but she may be on tamoxifen. You may get a station where there is a patient of breast cancer, she's on a tamoxifen, so you need to tell her that there may be multiple preparations. The safety is uncertain, different preparations may vary, it may interact with the drug that you're taking. Again, about phytoestrogens, what would you say? There are no studies comparing its effect with estrogen, and it is sold as a food substance and not as a medicine, which is why it is not regulated. Okay, so this is what you need to tell her. Vitamins, C, minerals, selenium, etc., limited benefit. Complementary therapies, RCTs, show that there is no benefit. This is acupressure, Ayurveda, etc. Okay. Now, in her, considering that HRT is not entirely safe, you tell her that HRT is the best or the most effective treatment. Okay. But considering that it is not entirely safe, you could consider other drugs for her, like SSRIs, because she has mood problems and hot flushes. Both of these problems would be taken care of by SSRIs. Side effects would be nausea, dizziness, problems with sleeping, etc. Okay, you need not elaborate on each of these components because you have to complete the station. If she asks you a specific question, okay, tell me about if it's safe, tell me if there are side effects. Or if you do realize that you have time, then you can go back and say, okay, this is what we can start for you, and these are the side effects. So what is more important is to mention all the points. Okay, so say that SSRIs can be considered. Okay, so here you're going to say in this station HRT is may be unsafe. We will need to seek advice. Okay, there are other options. You do not talk about herbal preparation, phytoestrogen, unless the patient says If you do have time in the end, then you can say that this is what it is. Okay. But you tell her what is recommended for her or what would be safest for her. Okay. So you enumerate those treatment modalities. So SSRIs, CBT, counseling, clonidine. Clonidine I mentioned here because she has hypertension. So what is mentioned as I was going through the literature is basically that if she has hypertension, then it may be one of the initial therapy that you can start because it would help both the problems, hot flushes as well as hypertension. Okay. As far as tibolone is concerned, it can help in sexual dysfunction, particularly if there is poor sexual desire. Okay, here that question should have been asked whether she feels like engaging in sex. Okay, if she does feel like engaging in sex, but the dryness is a problem, then tibolone you need not consider. But otherwise, if the sexual drive is a problem, then you consider tibolone. The problem with tibolone is increases the risk of stroke, and there is no definite evidence that it would affect the risk of cancer coming back. Calcium, vitamin D, as you mentioned, PIL, support groups and counselors, and genetic screen since she's got cancer at 46. So you need to ask her if she's undergone a genetic screen. If not, you need to say that we could seek advice of the specialist whether a genetic screen would be necessary. Okay, because she does not have any other family history of cancer. Then, these are just the points that I thought would be important because you can get patients or role players with different factors. Like you can get somebody with history of VT, you can get somebody like in this case, there was history of endometrial cancer. You may get somebody with history of breast cancer. So what are you going to say? Okay. Now, vaginal dryness is, I already mentioned to you that there is these vaginal gels that are available. So there are hydrating gels that are available, and there are vaginal estrogen therapy that is available, which may not be entirely safe in this scenario, but there is no systemic absorption, so you can use local therapy. There is no evidence to suggest that there is increased risk of the cancer coming back. Okay. The advantage of vaginal estrogen therapy is that it restores the pH and reduces the chance of cystitis. Okay. As far as the breast cancer is concerned, so if the symptoms, actually it is a contraindication for HRT, definitely. But what is said is if the symptoms are severe and unresponsive to other therapies, HRT may be considered under specialist supervision. Okay. So you need to tell as an ST5, it is safest for you to say that it is unsafe. However, if your symptoms do not get controlled with other measures, we could seek advice of the specialist. So always say that in this case, we would seek advice of the specialist or the HRT clinic, okay, or the menopause specialist basically, and your oncologist, right? Then in endometrial cancer, there is lack of evidence about the risk of recurrence with HRT. Okay. As far as VT is concerned, when there is personal history of VT, the patient should be referred for thrombophilia screen, and it is better to avoid using oral HRT. Okay. Transdermal may be considered provided patient is on anticoagulant therapy. Okay. When she is on HRT and she develops VTE, HRT should be stopped. And if she needs to continue HRT for whatever reason, like severe symptoms, etc., then anticoagulation should be considered lifelong, long term. Okay. Patients with very high risk of having VT, like type 1 antithrombin deficiency, you say that you would not recommend HRT. All right. So for an ST5, the safest would be for breast cancer and history of VT. You say that HRT is not safe. We can try other measures. If the symptoms do not resolve with other measures, then we would seek advice. You will not say that I will start. You say that we would seek advice. If it is VT, you say that you would need long-term anticoagulation. All right. As far as diabetes is concerned, diabetes, what is mentioned is that it is usually associated with other comorbidities, so it can have a synergistic effect. Estrogen alone may not be as harmful, but estrogen and progesterone, because progesterone is diabetogenic, then that combination has a theoretical risk in diabetes. Okay, but it is not absolute contraindication. Gallbladder disease, mild liver disease, previous liver disease, non-oral route of HRT can be preferred. Asthma, again, does not worsen pre-existing asthma, but there may be increased risk of newly diagnosed asthma in women taking HRT. Endometriosis, there is a theoretical risk. If you give estrogen to patient who's had endometriosis in the past and now she's menopausal, then there is a theoretical risk that the endometriosis can come back. But if a good clearance is done, then what is followed usually is that estrogen is not alone is not given for the first 6 months. Usually it is given with progesterone, combined therapy, or only progesterone is given. Okay, so these are certain specific situations which may come in the exam. Okay, like the patient may have a combination of diabetes, stroke, breast cancer, etc. So depending on the situation, this is what you would need to say in the station. Is that clear?
Yes.
All right. Do you have any questions? All right. If there are no questions, I think we can go to the next station. Dr. Uma, are you here? Hello? Dr. Uma?
Hello, yes, yes.
Okay. Let me. Okay. Right. Okay, the next station would be taken by Dr. Uma. Can we have a volunteer, please? And if you do have any questions on any of these stations, you can ask at the end, or you could post in the group.
I would like some non-course person. I think of the people who had messaged requesting to volunteer, I think Naseha, Dr. Naseha, some is one of the names. Is she here? Hello? Am I audible?
Yes, ma'am.
Yes. Okay. Let me know if you can see the screen. Hello? 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 Hello, doctor. Can you see the screen? Dr. Naseha? Hello? Guys, can someone confirm if I am audible?
Yes, ma'am. The screen is
Yes,
also
ma'am.
visible and you are audible.
Okay, so believe I cannot see the attendee names for some reason. So I would like really for someone to speak up and tell their name they're doing the station. Okay, hello.
Ma'am, if nobody is available, I can try. But I am poor student. So.
Who is this?
Shahina ma'am. Dr. Shahina.
Saina, hi.
Hi ma'am.
All right. We have discussed this, so
Yes
all
ma'am.
right.
If
Yeah.
anybody willing, then can do. I
Is
will
anybody
definitely.
else willing? I think the candidate just announced themselves and left. Very funny. Okay. Dr. Ankita,
Yeah, hello.
can you pick a name?
Uh, Dr.
I'm
Sahina was
unable to.
volunteering, I believe.
Okay. All right. Okay, Dr. Saina, I can proceed. I'll give you another minute.
Okay ma'am.
Okay, Sahina, I can start.
Yes. Yes. Hello, I'm Dr. Shahina, one of the doctors here today. What would you like to be addressed as?
Yeah, Claire is fine.
Okay. May I confirm your age, please?
I'm 36 too.
Okay. Claire, I can see that you have certain concerns, and I am aware of your situation.
Hmm.
I'm here to address all your concerns, but before that, may I ask you a few questions?
Oh, yeah, that's fine. Go ahead.
Okay. So, could you please tell me that, in your own words, what brings you here exactly?
Well, you see, Doctor, I was very career oriented right from the start, and now I'm 36.
Mm-hmm.
So although I have always had this thing as a maternal instinct, you can say that I wanted to always be a parent, but
Mm-hmm.
I know I'm running out of time, and I know that eventually it's going to get harder for me. And I
Mm-hmm.
was doing some research about this, and know that there are certain things that I can opt for
Mm-hmm.
in terms of preserving my fertility and maybe conceiving later if I plan to
Mm-hmm.
delay it. So
Mm-hmm.
I wanted to know more information about the same.
Yes, yes, I must appreciate your enthusiasm regarding this factor. This is quite concerning factor as well. And could you please tell me about your more about your periods?
Well, my periods are still yet very regular, never giving me any trouble, and yeah.
Mm-hmm.
So last one
Mm-hmm.
I can say
Mm.
was around 3 weeks ago.
Yes, okay. And any pain or passage of clots during your periods?
No, no, none of that.
Okay, okay. And have you ever been pregnant before?
No, I have never been pregnant.
And any family history of any genetic conditions or any other disease of concern?
No, no, nothing comes to mind particularly.
Any family history of or your personal history of clot formation in legs or lungs?
No,
And don't mind me asking, do you smoke
I don't smoke.
or drink alcohol
Occasionally, maybe a glass of wine, something like that.
or use any recreational drugs?
No, never, never.
And any other medical illness?
No,
Any surgeries?
no surgeries.
And what about your weight to height ratio?
I'm not so sure, but
Mhm.
I feel it's fine. I weigh around 60 kgs.
Okay,
My height is 1.6.
okay, I will note it
Yeah.
down.
Mhm.
Okay, and how is your support at home?
Yeah, I am quite capable of supporting myself. I live by
Mhm.
myself.
Okay, and are you feeling down, depressed in past few months?
No, nothing of that sort. Just a little concerned because this thought, keeps
Mm-hmm.
occurring to me. What if I'm not able to
Yes, yes,
conceive?
yes, surely I will address all this. And some personal questions. Are you in any relationship?
Yes, I am seeing someone for the past
Mm-hmm.
6 months almost,
Mm-hmm.
but you know how these things are, right?
Mm-hmm. Mm-hmm.
So it's
And
still on shaky
is
grounds.
he aware? Is he aware about these facts? And he also wants such
Mm,
type of.
no, I have not discussed anything with him as of now. I first wanted to get my facts straight.
Mhm. And do you have any problem in your sexual life?
No, no, not at all.
And do you use any contraceptives?
We use condoms.
Mhm. Okay. And
Yeah.
do you have any previous any sexually shared infections?
No, never.
And don't mind me asking some questions are necessary for your treatment purpose as well. Uh, do you ever had any cancer or chemotherapy or radiation therapy?
No, doctor, never.
Okay. Thank you for all these informations. Now, do you want to add something?
No, that's it. I think that's
Okay.
more than
Okay.
enough.
Now, coming to your concern, as you want to know about the fertility preservation, so do you have any idea about this, or have you read anywhere or heard anything about this?
I know that eggs can be kept in a frozen container, I
Mm-hmm.
think from somewhere,
Mm-hmm.
and maybe can be
Mm-hmm.
used later. So that's what I
Mm-hmm.
have read, but not details.
Mm-hmm. Mm-hmm. Yes, yes, you have read that right correctly.
Mm.
Now, let me tell you in detail that
Uh-huh.
eggs can be collected after giving certain medications to stimulate your ovaries to produce a large number of eggs. It takes around 2 to 3 weeks time, and generally 7 to 14 eggs are collected in each cycle. And this after stimulating the ovaries, the after production of these eggs, we would monitor it by doing transvaginal some ultrasound scans through your vagina, and we can detect that whether eggs are produced or not. And then these eggs are collected by some needles, and these are then preserved in very quick freezing is done, and
Mm.
this process is called vitrification, and this
Okay.
is preserved in some liquid nitrogen in the laboratory, and this would be kept there. This is one option, and in that case only your consent is needed for that.
Mm.
And you have to and this can be frozen, these things can be frozen for 55 years, but every 10 yearly you have to renew the consent form, and you have to keep your current address and contact numbers with the freezing center. And also in your case this would not be funded by the NHS. I must give you this information. Okay.
Oh, okay, that's fine. But what would be the cost that I have to bear?
It actually it depends upon the center. I can tell you after contacting with the center, or I can connect you with the fertility center regarding the costs. And
Mm.
also there is another option, that is the embryo preservation. By this your egg, and if you want your partner's sperm, then that can be fused in the laboratory, and the resulting embryo can be preserved in same manner like the egg. And the rules and regulations, legal aspects are almost same, but in that case your partners that the semen donor's consent is also needed, and if at any time he withdraws the consent, then you can't use that embryo. Okay.
I see. Okay.
uh, and there are certain other aspects also. If you might change your decision in future, and you become pregnant by natural way, and if you don't want to preserve your embryos or your egg in any case, in that
Mhm.
case you may donate that, or if you discontinue funding, then they may use this in research purpose also. Okay.
I see. Okay. Mm-hmm. All
So
right. Doctor, any complications I should be aware of?
Uh, yes. The complications that may have with this egg production process, it sometimes the ovaries may respond hyperenthusiastically, and we call this as ovarian hyperstimulation syndrome. In that case, sometimes bloating sensation and some breathlessness, some fluid collection around tummy or chest or around the heart that may occur, and sometimes this may become serious condition also. Otherwise, there is little bit pain or some minor symptoms that are manageable by treatment also, and for these symptoms also there is treatment. But another concern is the eggs might not be collected, and there is another side effect, or another mm, uh, bad thing is that the embryo, the egg that will be reserved, that may not be able to capable to buy that egg, may not be able to produce any embryos in future as well. There is risk of failure as well. Okay, I must tell you that
Mm-hmm.
thing also. Okay, so as I am giving you a
I
lot
see.
of information, I would like to
Mhm.
give you some written information regarding this, some patient information leaflet, and can connect you with the fertility center as well to know better about the options in details also, and can write back to your GP also, and can give you connection with some support groups and also some counselors if you think you need.
Mhm.
Okay,
Okay.
so do you have any other concerns?
No, doctor, not at this point.
Okay, okay, thank you.
Mm. Okay.
Mm, yes.
I had one query. What is the difference between embryo and oocyte? But the legal difference of that which you had already covered. So I wanted to know, but you know the answer to this, and I'm pretty sure about it. So therefore, okay. Any reflection, Dr. Saina?
One point I forgot, that if
Mm,
she
mm.
delays pregnancy, the effect of
Yes.
increasing age, that needs to be told her. That thing I totally forgot.
Okay, but
Mm,
very impressive. I mean,
mm,
it shows the importance you are giving, that you're very attentive and you're following each and everything that was advised to the T, and therefore, I mean, the performance I see in you that improvement is there every time. Actually, I
I'm
had asked
trying,
for
ma'am.
somebody who
To yes.
who wasn't from the course, because I mean, this has been discussed with the candidates from within the course. So therefore, we would have liked to see a performance outside of it. But nonetheless, this is
Ma'am,
also
nobody was
equally
not
good because,
responding, so
yeah, it's good. It's good. I'm very
yes.
happy. I'm
I
very
thought.
happy that all our hard
I
work,
have
your hard
not
work,
practiced this
ultimately.
station also. I have just heard your class. I thought that to practice myself, but didn't get time. The oncology module was going on,
In
and
which
now
case
course
it
has
is
finished.
even bigger achievement, I would say. And I'm happy that you're picking up in the phrasing of the sentences is exactly like how I used it as well. Like you said, the shortest way of saying OHSS is ovaries responded hyper enthusiastically or over enthusiastically and released a lot of eggs. So it's the shortest way of being able to explain it. You are listening and you're basically picking up on that, and that's very impressive. Okay.
Yes, thank you, ma'am.
Okay. Yeah, so I don't have, because your feedback also you yourself gave your own self, which is that you missed out on the point that if she
Yes.
delays
Mm-hmm.
pregnancy by far too much, then
Mm-hmm.
she becomes an advanced maternal age, and whatsoever is the complications associated with the same will all apply to her. So that's another point that she needs to be warned about in terms
Yes.
of patient safety.
Mm-hmm.
But otherwise, I don't think I have too much of a thing. In fact, I'm going to just, you know, I have made a list of where all to appreciate you, and I think I will use that as the template for my feedback so that everybody is also enlightened in the same way. Okay. So, if you remember how Dr. Sahina started the station, which is a very uh, important thing which I advise about in all my classes is that you don't use too many sentences to make yourself familiar or become comfortable within the station. You ask one question, okay, which is what would you like to be addressed at, rather than may I confirm your name and age. Then the role player replies, and you like, what would you like to be addressed as, which is a second thing. So even if it's a few seconds that you're saving that in each of your stations, in all 14 stations in the circuit, and it eventually one of those stations, if you run out of one point for a few seconds, you might miss out. Okay, so because of that, healthy habits while you're practicing will go a long way into making sure that you finally have a good outcome, right? So one thing was the start of this, and then she started off with an open question, which was direct. Yeah, I am aware about your situation, but can you tell me in your own words what it is? So then that gives the ball in the role player's court. They are able to tell you whatever the script permits them to do. Okay, so the script allowed me to tell you my issues with my concerns about fertility and that I want to become a mother at some point, and I have read up somewhere, but I want to know more details of it. One thing you could always try to gauge what the role player's level of understanding may be, or financial aspect may be. So the important question is with regards to occupation, which is another thing that you can always ask. Okay, and so you know where they stand and whether they're affording, not affording, especially when it comes to subfertility module, where a lot of the times the fertility preservation which these patients are going for funded for whatsoever reason. Now, in this situation, the fertility preservation will not get funded. Can somebody tell me what are the situations in patients where fertility preservation is not funded?
And if the couple has no any children in the past, and if their ovarian reserve is fine, and they are
Preservation,
not smoking.
preservation. You're talking about IVF will be funded. IVF funding
Yeah,
criteria almost everybody. I'm talking
okay.
about fertility preservation, like whether oocyte preservation or embryo preservation
I think
or
in the patient is if taking the treatment for the ovarian malignancy, like any for any malignancy, they are taking the treatment. In that
yes.
situation, it is funded by the NHS.
Yes. So it may be funded by the NHS depending on the
Maybe.
area where the patient lives. Okay. The
Mm-hmm.
other scenario where they might, but it is very unlikely to come up in the exams, is if somebody is going to war. Okay. So if it's a army related thing and the person is concerned about having any sort of exposure or harm, bodily harm, which may not allow them to conceive in the future. And this applies more to the male part. So that's why I'm telling you. But in case that is just the legal ways of looking at things. That if someone is going in the army, okay, on the front or something like that, then yes, preservation is can be can be funded depending on the area where they live. And why I'm saying this is because the clinical commissioning groups are the final authority in deciding who can get funding for preservation, who can get funding for IVF and other. Okay, so these are the things you have to keep in mind as far as funding is there, and that's going to be a major aspect of most of your subfertility stations. So you have to, and as you were saying, your IVF funding will be neither of them should have a living child, okay, and both should be non-smoking, okay, and age and BMI related will be there, okay. So as per is given in your NICE guideline. Now, just because somebody fulfills a criteria does not mean that they will always get funded. Okay, they may not. Second thing is the waiting list may be a very, very long time. So waiting periods are quite lengthy. So these are two things that you have to be aware of, and usually patients need to be made aware of when they are coming for fertility treatments. Clear, everyone?
Yes, ma'am.
Come on,
Dr.
Miss
Uma,
Uma,
one
what is this?
as we in the introduction, we ask regarding the what are our expectations, then we make the agenda, and then we ask the open question.
Um, no, see, when you do a consultation in the OPD,
Hmm.
what do you do normally?
Okay.
Do you speak in terms of like, okay, today I'm here, I will ask you a history, then I'll examine you, then I'll do this, then we will do safe, mutually agreed management plan. Blah, blah, blah. Do you start a meeting of that sort? No.
No.
Your agenda can be very, very short and crisp. It usually has to be, see, why we say set agenda, set a clear agenda to the meeting
Hmm.
is because you have to know the purpose of this consultation, or you have to
Yeah.
have that definition being made.
Hmm.
If you start off by saying, okay, can you tell me more about your problems?
Hmm.
Once that happens, you can set an agenda saying, okay, I'm here to address these things for you.
Hmm.
Because here the open question itself was, can you tell me more about your concerns? So why do you want to ask two separate things like and waste additional time setting up an additional agenda and then go to your open question and say, okay, yeah, I'm here to help you with this, don't worry. And then you go on to this. Agenda can be set before or after the open question. I think after is a saves time. Okay.
Hmm.
Hmm?
No, ma'am, I mean to
So
say that like initially we start that you are here to, I understand from your notes that you are here for the fertility preservation. So do you have any other concerns to discuss? Should we say this, or we go with the open-end question? Can you tell me more about that?
open-ended. Open-ended.
Okay,
My recommendation is open-ended. You go
okay,
straight
okay.
away to, can you tell me, I would like to ask a few more things about that. Can you tell me
Hmm.
in your own words what it is? Let them describe the problem statement, and then you go on to your agenda setting, which is,
Hmm.
yes, you are
Okay.
going to do, okay, I may need to ask a few more to clarify a
Hmm.
few things from my end,
Hmm.
and then
Hmm.
we can discuss any concerns that you have. Okay.
Okay, yeah, thank you.
So that's how you, yeah. So the next is why she exactly wanted preservation. That was brought up during that conversation itself. And moment I said something even slightly distressing. I said, I have been worried about, wanting to become a parent. I've read that it, is going to be an issue down the line. So immediately, as Dr. Saina well appreciated, is that you expressed even at that moment empathy. You said, "Yeah, yeah, I understand about this thing. I'm here to help you with this thing." So that's really something which I appreciate. Usually, you didn't move past that, even if it was a minor thing, which I sort of didn't say that it's causing me any sort of distress or anything, but you still addressed it very good. Open question was very good. In terms of your history here, and I was waiting for this one, but you eventually came to ask about the relationship. That is the vital thing in this station, is to ask. One is obviously other fertility related history, including her menstrual history, including her obstetric history if she's ever conceived before. If it's unclear why she wants to delay pregnancy, then to get to the bottom of that would have been essential. But here, as she mentions that in her open answer, it's not required to repeat it. So that was good. About partner, okay, is she currently having somebody? That's important. And uh, if has she discussed this issue with the partner? All right, because you want to know if she would be a viable candidate for you to talk about ovum donation, ovum preservation only, or you want to talk about ovum and embryo cryopreservation, and then you give her a comparison between the two. So, and then she is able to choose between the two, depending on the pros and cons. Okay. So, any history of early menopause in the family? Family history, it's significant in terms of if she has had any family history of cancers, family history of early menopause, which sort of kind of gives you an idea about the longevity that her oocytes may have. Okay, and any history of supported difficulty conceiving in the women in the family, especially. Okay. And then past history, like herself having taken treatment for any cancer, like radiation, chemotherapy. And again, Dr. Sahina, very well done with signposting before that question. Okay. And in fact, I was like in my head, okay, this is really, really good. Is if other people haven't noticed it, she mentioned that I may have to ask you a few questions which will explain your condition better, and then went to have you had any history of taking treatment for cancers in the past, like chemotherapy, radiation? Because if you do not signpost this question, if it catches the role player, off their guard, then it can be slightly offensive, or they may raise an eyebrow at this. Why is this happening? Okay, so the way that you ask that particular question is also very, very important in terms of your communication. Very well done. Okay, and occupation, as I had told you, for two reasons. One is the financial aspect of it. Okay, financial stability, educational level, and if there are any chemical or radiation exposure, which could be an occupational exposure, which may degrade the air quality, whatever you may have to take into account. Okay. Then, if any tests have been done for her, would be another thing that you can ask for, like if she's gone to the GP, done anything which may indicate a reserve for her, like any AMH, etc. And others, of course, the template you have to complete with medical disorders, any prior surgeries, allergies, any addictions that she has, including smoking, alcohol, recreational drugs. Okay, BMI. Now, a recent trend in the exams is that you ask BMI, they don't give you a number. You should have an approximation in your mind by seeing a lot of patients. Okay, like somebody gives you the weight and the height, you should be able to tell whether this is fitting in the normal range or it isn't. All right, so get into the habit, or while you're practicing with your study partners, quiz each other in this manner sometimes. Okay, and sexual history support. Mental health important in terms of, yeah, this situation can be distressing sometimes, and how are you coping with it would have been an additional question if the role player hadn't already told you about what they're going through has been little distressing or traumatic for them. Okay, so if none of that is covered, then you would have asked if in this situation, then it can be sometimes a little distressing for some individuals. How are you dealing with it? Would you like to see someone? Would you want some help, counselors? This is the way you ask. Remember that in almost all subfertility stations, and especially this one, fertility preserving individuals who have come for this particular option, you have to always offer counseling. So it's going to be there in your answer key. It's going to be a part of your patient safety. Just like how PILs and support group is going to be there as a part of your patient safety. Here, counselors are definitely going to be there, and you can either cover that here or towards the end of the station. But if you run out of time, you may miss out on the point. So remember, this is very, very, very important. Okay, clear to everyone? Is my voice still interrupted? Somebody has messaged on the chat box.
No, ma'am, it's clear now.
Yeah,
Interrupting in the middle.
okay. Was anything not clear with what I was saying this far? Okay.
No, but
All right.
that BMI calculation has become very difficult thing.
So, which is why I told you, let me be
Calculating
here with
little
you.
bit
When I
time.
mentioned the weight of 60 kilogram for a tall woman is
Mhm.
you should be able to put it together. So it'll be around between say 23, 24 maybe, or even less than that, but it's normal. So that's fine. Now, when you go to the once your history is done, you know, thank you for this information. Let us come to discussing your this. What is your do you have any idea about how we proceed about this? Very, very good. Very important question. Like, what is the patient's background knowledge? Okay. So, why is this important? If they say, I know this, I know a certain thing, you don't have to repeat it. Means you're not getting any marks for it. You're not going to get any marks for repeating what the role player script says that they already are aware of. You get marks for answering their questions or building up on their knowledge only. Okay, so once she says, "Yeah, I'm aware to about the egg preservation, but I don't know much more than that." So I just wanted to get my concept clear. So here you have ended up in a situation where she has somebody, she is in a relationship, but she's not quite certain if this is the same man that she would, you know, end up with, uh, or plans of having a child with. So you don't know. So in this situation, yes, it's appropriate to talk about both oocyte and embryo cryopreservation, which, as you did, you can either club them up together, like say that there are options in women like you who want to delay pregnancy for their personal reason to now freeze the egg or freeze the embryo, which is the we take the egg and fertilize it with either a known person's or a partner's sperm or a donor sperm as per the patient wishes, and then that is preserved in a little advanced stage. Okay. So, and this can be, as you said, preserved as of from 1st of July 2022. The regulations in HIFA have changed from earlier, they used to be able to preserve only up till a period of 10 years, but now a woman can store, or a man, if it's a sperm, they can store for up till 55 years from the date of freezing with the addendum that they must renew their consent for this storage, okay, and make sure that the payments to the storage facility are completed in a timely fashion. So every 10 years they are going to have to renew this. If they do not fulfill that consent or they do not pay in time for the facility, then the facility may discard the samples. Okay, clear everybody? Legal aspect?
Yes, ma'am. Ma'am, can we get some the document related to these both options? Any
Yes.
written information, so that we can get to know in a better way, like all this information and legal
Okay.
implications.
What happened? You don't trust us or what? Okay, I'll share it with you.
Okay.
No, I'm telling you in quite a bit of detail, but yeah, I'll share it with you, no problem. So, so you have
Ma'am, how much
um,
to pay in that? What to answer?
that, yeah, I'll tell you, I'll tell you. So it's okay. The way you handled it was also fine. If you don't answer one particular question, which may be a very nuanced thing, which not many people might know, it's still fine. If you say that I may have to discuss with consultant or discuss with the facility and get back to you, that's also okay. But now, since you know that this was one of the questions, you can keep in mind, okay? And now, one thing is, if, however, she wishes to discontinue storage, then she just has to inform the center, uh, which in which case they can either be instructed to discard it, or she can choose with her consent whether to donate it for research or donate it to another individual for their treatment, fertility treatment. Okay, so these are the options available in that in case she does not wish to use it in the future. So say she, as she mentioned, if you get pregnant, okay, on your own, or if plan changes, then this is the way to go about it. Note that there are major differences in terms of the embryo and oocyte is both are now preserved by a fast freezing that is called as vitrification, but and stored in liquid nitrogen for prolonged period of time, which doesn't damage the oocyte and doesn't damage the embryo to that great an extent as slow freezing used to. So the outcomes of fast freezing are much better in terms of how many of them remain intact. So almost now latest meta-analysis have suggested that almost 90% of them can be retrieved. Now, subsequent pregnancy rates from fresh or frozen still remain the same, but frozen embryos also have a very good outcome of retrieval. And even now with vitrification, the oocyte preservation also has very good outcomes. Okay, so that's something you need to make them aware of. But major differences in terms of the legal implication. Oocyte requires only her consent, but the embryo requires both her and the male, that is the sperm donors or partners consent. And anytime if the donor or the partner withdraws their consent, then they have to destroy, they'll have to discard the embryo. Okay, so it doesn't just depend on her. For all practical purposes, there's a 1 year cooling off period which is allowed, but still, if he keeps uh, the same opinion that he wants to discard it, it will get discarded. Is that clear? Any questions on this?
Clear, ma'am. Thank you.
Yeah. Then, um, all right. So, coming to the next question, which is if this is not going to get funded, and very good again on mentioning the funding yourself, because if you do not do this, the role player doesn't get to know sometimes in the station whether something, that treatment that you have spoken about is getting funded or not getting funded. They should not walk out of the station not knowing that the funding isn't available. Okay, that's a big blunder on patient safety perspective, because then they may be under a misconception that this doctor didn't mention anything to me, therefore my treatment is funded, and they walk out of it and then they get enraged when they find out that it is not funded. So it's your job and good on mentioning that it's not funded. I said it's fine, but you would have lost patient safety marks if you hadn't mentioned it. Okay, now the average cost of having the eggs collected and frozen is between 3,300 to 3,500 pounds. Okay, and the added medication expense comes to around 1,000. So that would be 4,500 pounds on a general basis. And the storage costs are extra, tend to be between 125 to 350 pounds per year. Okay, so that's the cost factor of it. All
Ma'am,
right.
please repeat
So
this once.
yeah,
The
so
first.
retrieval procedure and medications. Okay, so the retrieval procedure, surgical,
Hmm.
may
Hmm.
be between 3,300 to 3,500. Okay, GBP, and The medications are about 1,000, and additional storage cost, depending on facility, cost anywhere between 125 to 350 pounds. Mm.
Okay.
You have to add another patient safety point, which is that uh, in case of oocyte, okay, or embryo, both in which case both partners will be tested for any viral infection, which is HIV, hepatitis
Yes,
prior to
yes.
that. That is not something that precludes them from storing the egg or embryo, but it's just that it has to be stored in the correct place. Okay, so that to avoid cross contamination with other samples, it is tested. Okay. Also, what else in applied clinical knowledge? Say I'm coming to you saying that I want to be a mom someday and I feel I want to preserve fertility. Is that my only option?
No, there are other options also, surrogacy and adoption.
Adoption. Okay. I would
Yes.
not say this has a lot of weightage in ACK mode, I mean domain. Okay. But for completion's sake,
Can
all
mention,
right, at
yes.
the end you have to be able to tell them that this is. And although fertility preservation is one of the options, and then you can conceive later, some people may also consider alternatives like adoption, surrogacy. Would you want to hear? Usually, obviously, she'll say no because it's not what the station agenda is about. But it's about you talking about one particular procedure and having withheld information about the alternatives would cost you. So it's like, hmm. Now coming to complications, you covered very well. Complications of the procedure itself, it's the over-enthusiastic response of the ovaries releasing too many eggs, what we call as ovarian hyperstimulation syndrome, may happen. Usually, this is taken care of within the fertility center or a gynec center. There may be the pregnancies which result with test tube babies because she will have a test tube baby, right? Eventually, maybe twins or triplet pregnancy is more likely that it can happen. Okay, that is one, and which you mentioned very, very nicely is very important. The egg or embryo preservation doesn't ensure that all the samples sometimes, okay, sometimes they get damaged, some of them get damaged, and very rarely all of them may be damaged. So we may not be able to use or may not result in a pregnancy later. It is not correct if they are under the impression that you preserve it today, 100% they're going to have a baby at a later point of time. Okay, again, that's a misconception you have to deal with. All right, very important patient safety perspective in terms of she asking complications. Okay, so everybody will talk about OHSS and this and that about the procedure, but it's important to tell her she may not be able to end up with a baby. Okay, and the delaying of the pregnancies may be associated with her being a mother at a later age, which itself is associated with some complications, which include a higher risk of being diabetic, diabetes, hypertension of pregnancy, early deliveries, growth problems in the baby, okay, increased chance of cesarean sections, operative interventions, mental health problems, miscarriages, etc., owing to her age. Okay, so then you say we'll document all this discussion with you, give you some counseling support, okay, information leaflet, have a further appointment with the consultant once you've made up your mind about this. Okay. The partner thing was important in terms of there has to be clarity between you and her as to what is his role in this. Okay. Has she thought of, utilizing maybe his or someone else does she have in mind to be a sperm donor? In that case, yes, embryo is an option. She can choose right away also. Mm. So the pregnancy rates as of now between embryo and oocyte preservation, whether it is fresh or frozen, are comparable as per the latest data. Okay. So Dr. Saina, well done.
Yes,
few
ma'am. Thank
points
you.
which I have told you,
Yes, yes.
and
That helped me to add
otherwise
it.
impressive because
Yes, I will
we
practice it again.
still have time, still can practice, can
Yes. Yes.
uh, do very well. Yes.
Thank you.
Dr. Uma,
Yeah.
I would like to ask one question. Like the embryo and the oocyte preservation are the two options. Like in the talk, they mentioned that ovarian tissue transposition, although it is an experimental, should we say about the name of that or not? We mentioned these two options.
No, Papa. No, what is that in context with? That talk which you're talking about is fertility preservation options for cancer patients, right? Those are oncological treatments and other things, right? So in that
Mm-hmm.
there are multiple options in that which you haven't at all to be discussed with this individual.
Okay,
Her
okay, okay,
indication is different.
okay,
So
yeah.
if I had given you talk to a 17-year-old girl
Mm-hmm.
who has dysgerminoma, okay,
Hmm.
and you want to
In
talk
that
to her about
situation, we will
options of
see that.
yes,
Hmm.
then all those options will come,
Hmm.
not just transposition.
Okay,
Okay,
yeah.
and you have to
Okay.
talk about ovarian tissue cryopreservation also.
Hmm.
This obviously you can't get oocytes in a woman who's like that young girl.
Hmm.
It is not
Hmm.
advisable to do
It's still
hyperstimulation and
experimental, yeah. Hmm.
yeah,
Hmm.
no, no. The reason that is an
Hmm.
option there, that is a better option there to preserve the
Hmm.
entire slice of the ovarian tissue, is because you cannot do retrieval
The
of oocytes in
pre-pubertal.
that young. You cannot do. One is you will not be able to
Hmm.
do the transvaginal procedure. Second is
Hmm.
it is not advisable to stimulate their eggs to M2
Extra,
stage
yeah.
at that
Hmm.
volume. So that's the reason it is not done. Therefore, there are
Hmm.
multiple other options in there. Okay.
Okay.
In that individual, yes, of course, you will talk about all the other issues which are there. In fact, you will talk about those options rather than talking about oocyte and embryo preservation. Where will she preserve embryo? 17-year-old girl obviously will not preserve
Not
embryo with a
preserved.